Here's an egg. Can you see that?
Yeah, perfectly.
Okay, there's a sperm. So men are pretty simple. We're just a package of 23 chromosomes with a tail that have to get there. But the whole fate of a baby hinges on this egg being healthy, hinges on this egg kicking out half the chromosomes properly, because as you know, your eggs start as 46 chromosome cells that have to be 23, just like the sperm, so that you get half from dad and half from mom. And that happens when you ovulate and fertilize the egg. So a younger woman, the egg does it better. And then on top of that, here's an embryo 3 days later. All of these cells dividing depend on this being a healthy cell to start with. And as eggs get older, they get less healthy. So it lowers the odds, but not just from a health perspective, it's really chromosomes, that the majority of these embryos are chromosomally unhealthy. And people don't realize that. That's why in 1986, I started biopsying embryos. And this is actually a picture of the first successful United States embryo biopsy. We were the second. We couldn't do it until the Brits did it first and were successful. I couldn't even get permission. Yeah, exactly. You guys are way ahead of us technology-wise. Your regulators are much more understanding. They wouldn't let us do this, but once the Brits were successful, this is a woman, she's 28 years old now. We took a cell out and tested for hemophilia. She had a 25% risk of that. She's 28 years old and doesn't have hemophilia, but this was the precursor of what we now do. We now grow embryos longer. So this is an embryo 5 days after fertilization. And now we take several cells from the embryo and we can count chromosomes. And so what I want to show you now, as a way to scientifically understand what happens to women's biology with age, because that's really the secret sauce to understanding your fertility and making good decisions around your fertility. That's not where I want to be. What percent of these embryos, depending on age of woman, make a baby? So if you just select an embryo by how it looks, these are day 5 embryos. And then what percent of these embryos, if you take cells from them, are chromosomally healthy? That's what I want to show you next. So I'm going to pull up more slides. If I can share another slide here. Are you okay?
Yeah, I just wanted to jump in there because you were talking about embryos. So for anyone unaware, that's a fertilized egg, right? So the majority of the people that freeze their eggs wouldn't necessarily be freezing embryos. Is there any way for them to be able to kind of analyze this process?
Yeah, it's brilliant, but no, we don't. We've been working on a method that's reliable. We haven't gotten there yet. I don't know that we really ever can fully get there because, an embryo. Let me go back a little bit. An embryo requires the sperm and the chromosomal health of the embryo. The sperm are part of that, although mostly it's the egg. But here's what I was showing you before. Here's the risk for Down syndrome with age. You can see how it changes. This slide suggests that as women get older, fewer embryos are chromosomally healthy. So does this slide, which is the first amniocentesis data. You take fluid from around the baby and ask the question, is the baby healthy? Does it have the right chromosomes? And you see that, is a very small number, 2 per 1,000. But look where my average age patient's here. It's almost 2%. That's a big number. And the reason is, if you look at, let's put back the best looking day 5 embryo and look at how maternal age affects it, not paternal age. Dad's age doesn't matter that much. But here's the clock. This is what women worry about. And really, it's kind of after 44 where we fail miserably with IVF because of what happens to eggs as you get older. And you see this curve, you see how much it changes. You kind of see it's not so bad in the 30s, but as you start to get, 37, 38, that's where it starts to see the decline.
And with that said, what would you consider the ideal age, if there is such a thing for
Yeah, that's a great question. Probably somewhere in this range, because younger than that, who knows? You may be having your first baby here already. You don't need to freeze your eggs. So it's you want to wait, but you don't want to wait too long. And if you could predict your future, you'd know exactly the best time to freeze your eggs. But we do pretty well, and then we start to see a decline, just like in IVF, as women get along at this age. But here's a question for you. Here's an egg donor. Why does a 25-year-old peak fertility egg donor only have 58%? And why does this curve drop? Well, I already gave you the answer. I said that the percent of embryos that are normal, that's what euploid means, a chromosomally healthy embryo. what percent of embryos are chromosomally healthy as women age? And you can see what happens. And it's not your fault. It's not because you had a drink or you smoked a cigarette, although cigarettes are the worst thing you can do for your eggs. Drinking, not so much, doesn't hurt so much. A little bit is fine. But the reality is you can't control this. This is natural biology. And with age, fewer and fewer of the eggs you ovulate make healthy embryos. And that's why I'm so busy. And that's why if you freeze your eggs here, you're going to have this, preserve this fertility potential. I mean, let's look at it differently. Let's look at hundreds of patients who do IVF, okay? And you ask, how does age affect what happens to the eggs you start with how many embryos you get, how many embryos actually make it to day 5 that are viable and have a chance of making you pregnant, and then the number that are actually healthy. And then what percent, I showed you on the last graph, are normal with age. And you can see that's a falling number. And what percent of cycles, despite a large number of eggs, do we not even get one normal embryo? You can see. So look at my average patient who's 39. 14 eggs represents a year and 2 months of trying. They don't all fertilize. They don't all grow to day 5 because they're not all healthy. And the ones who get to day 5, a lot of those aren't healthy because 26% of them are chromosomally normal and 74% are not. So you're down to 14 eggs translating into one average healthy embryo, except 33% of these patients, 14 eggs doesn't even get one.
And so somebody freezing their eggs at, let's say, age 35, and then struggling to conceive and needing to use those frozen eggs at 39, instead of having that, that kind of euploid level, instead of having that, they would have the same level as the 35-year-old self.
So now that we've been thawing eggs for over 15 years, actually we've been freezing and thawing eggs for 20 years. And now we're even testing embryos that come from frozen eggs. We're finding that what runs true in IVF runs true with frozen eggs, that we average this number of normal embryos depending on the age at which we froze the eggs. So you freeze your eggs here, a batch of eggs gives you a chance of getting 3 healthy embryos. You freeze down here, and look, we have several 42-year-old women who got a baby from frozen eggs, but boy, 12 eggs, you barely get one normal embryo. You almost have to have almost 30 eggs to get one normal embryo.
So I guess then, does that mean that, whilst we're always told there's no guarantees through egg freezing, and it's certainly not something that people can rely on, what you can say quite confidently is that you can buy yourself the chances of your younger self by freezing your eggs?
So what happens is, if you freeze your eggs here, when you use them here, you get this fertility rate. That's what we showed. And indeed, in the first study where we did 23 free cycles, we had a 57% baby rate. The mean age of those were infertility patients was 32, and 31 to 32. And we have about a 55% baby rate in that group of patients. So we showed frozen eggs could get us the same rates. The first 5 years of freezing eggs from 2005 to 2009, where we actually did this clinically for patients who wanted to preserve their fertility. We had 200 women see us. It was still considered experimental. So, not many people showed up. It was frowned upon. People invented terms like social egg freezing. I don't like that term. It's so derogatory. It makes it sound like you're doing something cosmetic.
Yeah.
Fertility is not cosmetic. Fertility is a big part of your life. And because we're delaying, say it again?
What would you call it instead? Would you call it maybe
elective cryopreservation of fertility, or elective fertility preservation, or intentional fertility planning, something more positive.
Yeah.
Social has kind of a judgment term to it, if you know what it is.
Totally.
Yeah, and I don't like to judge my patients. I like to help my patients. I don't judge. That's not my job as a doctor. My job is to be empathetic, understanding, and help educate patients so they make good decisions, so they don't look back and regret, so they don't make the wrong decisions because they didn't have the right information. That's why I'm doing this. I want you to learn so that you can understand what it is that makes you less fertile with age. It's not your fault. It's this lousy biologic system that we inherited 2 million years ago, and there's been no evolutionary change on it. And we've changed.
And so if we can consider the technology and, something that you very much help bring into practice as the evolution, then, what we're talking about is 2005 when you first started working on this, and then you were talking about, 2009, some of the first patients that you were testing on. That's a long time ago. And obviously medicine is incremental and things have got to be stress tested before they go into practice. But, why did it take so long for egg freezing to evolve or hit the mainstream, do you think?
Well, first of all, the one thing that helped us was that free clinical trial, because then we had data we could offer patients. But the patients who showed up from 2005 to 2009 were average age almost 39. And there were only 200 of them that showed up, and they froze, some of them froze more than one batch of eggs. But now that they're all over 50, we think they're pretty much done. And those patients, only 80 of them came back to use their eggs. And we don't know why some of them didn't. Some of them probably had natural pregnancies and never needed them. Some chose not to use them. We don't know. But the 80 who came back, we have 32 babies in those 80 patients. And if you think the mean age is 38 and 39, where you expect about a 30% baby rate, we got 32 babies in those 80 patients. Some patients got more than one baby. We showed again that we could get the same expected baby rate for a group of women at the age at which they froze eggs. Now we're seeing women freeze their eggs much younger. And because of that, we're getting better results. And we're also seeing patients saying, well, if I only have 10 eggs in the freezer, that's not a very good chance. Look at what happens to them. Why don't I do more than one cycle? So as women are doing more than one cycle, we're able to get more of them a success. We have over 220 babies from patients who froze their eggs. We've frozen 3,600 cycles of eggs. We've only thought about 350 cycles of eggs because most of the freezings happened the last 5 years. It's really caught on the last 5 years. And COVID, this year, since COVID, we've seen a 34% uptick in egg freezing.
I was actually just going to ask you about that, saying, kind of bringing it up to date. You're seeing more people coming in, you're seeing younger people coming in, which obviously improves success rates and sort of makes other people more inclined to do the same, as it's spoken about a lot more. But has COVID been a real shift? Do you think it's made a lot more people think proactively about the future?
I think that's a big piece of our increase. I think it was organically growing anyway, because now as more reports of success are out there and people are seeing the actual literature, the scientific literature saying that, we help a lot of people, not everybody, they're starting to make a decision and a choice that, okay, I'm going to freeze my eggs to protect myself so I can be my own egg donor in the future if I need them. And women are being preemptive. And also, insurance coverage of that entity is now happening in the States. And so I think that the biggest obstacle is the cost. It's very expensive. The good news is it's less expensive than an egg donor cycle, but it's still costly. And that's a barrier for many, many individuals. So I think it's a kind of a perfect storm of a time in our lives where we're in laser focus about what we want to get out of our lives, where life has slowed down because of the virus and the pandemic. I think it's focused a lot of women on their fertility, which is a good thing, although not always comfortable, if you know what I mean. It's not comfortable to worry about your fertility when you're not in a situation where you can do anything about it. Except now, with egg freezing, you can do something about it. It's just not a perfect technology. I would never try and say, hey, look, you do this, you're fine. You're never fine until you have the baby, but your chances will be better by having eggs in the freezer than waiting and letting nature take its course. And for many of our patients, our frozen eggs were the second baby or the third baby they wouldn't have had they not frozen their eggs. We have amazing stories.
So looking forward, you're speaking, about people planning for the future there. Are there any kind of tools or techniques or technologies that you've become aware of or that you're working on yourself that you think are going to kind of bring egg freezing or other fertility treatments further forward or improve success rates over the next few years?
So several years ago, we did a free clinical trial where we tried to biopsy the egg before we froze it to see if we could identify it as being chromosomally healthy, and then have a patient have a better understanding of what chance of success is. Because until we make embryos and know how many normal embryos we're going to get from that cycle, we don't know how good the success rate will be other than what the expected success rate is at a particular age. So like a 30-year-old, we would expect about a 50% baby rate. The idea is if we could biopsy the egg and see how many were chromosomally healthy, we get a better assessment of it. But it's actually a very difficult test to do, and it wasn't that reliable in terms of predicting the future. And so that test doesn't do it for us, but I'm sure someday we'll figure out some test. I think probably just sheer numbers will be the best way to do it, and we'll figure out ways to get more eggs because it's a numbers game. Look at this graph. This basically says your fertility is based on statistics, odds, and dumb luck of getting one good embryo. And, you know, the people who tried 1 month, let's say a 32-year-old tried 1 month and got pregnant, were lucky they got that embryo. And the people who tried 18 months and didn't were unlucky that they didn't get that embryo. They were this 14%. Doesn't mean they can't get it. But, you know, a lot of these patients who got the embryo the first time they tried at 32 are my patient the next time they try at 34 and they think something's wrong and nothing's changed. Had they missed that month, they would have been my patient the first time around. They just didn't realize they picked the lucky month that was going to get that embryo. And no one's ever framed your fertility in that way. We assume it. We assume that it's so easy to get pregnant. We assume we're in control of it. And none of that's true. It's so biology.
Well, and we can give biology a helping hand, as we've seen. And I had this interesting conversation with an incredibly intelligent woman in her 30s who said to me, I'm not going to freeze my eggs because by the time I think I want to start a family, I think technology might have moved on. What do you think about things like growing eggs and growing sperm from stem cells? Or are there any things that you see on the near horizon that would mean that eventually we won't need to freeze?
Yes, I mean, we've been talking about doing those things for as long as I've been in this field, like 30 years. Mm-hmm. And we haven't found the proper conditions nor the proper safety technology to use that clinically yet. So she might be right, but she might be wrong. You know, no one can predict the future. It wouldn't shock me if in a few years we're totally doing things differently. We take skin cells and make eggs from them. You know, we just do a skin biopsy and grow your eggs in the lab. That's always been the thought, but I've been hearing that thought since the 80s, and we're still not there. Egg freezing is something that is not perfect. It has success limited by the age at which we freeze the eggs and the number of eggs, but it has a lot more success than any other thing that we have currently. So it's one potential thing. And look, freezing eggs is not new. We've been doing it for egg donor. Our network of clinics that has My Egg Bank in our network, we have over 5,000 babies from frozen eggs from egg donors. But I've only presented you the data of women who are preserving their fertility. They're much older than egg donors. They're not egg donors. And that's a more honest discussion for a patient who's considering, you know, elective fertility preservation or social egg freezing, as it's called in other countries. You know, it's a more honest assessment. It's, you know, we're not going to be as successful as with frozen donor eggs because they're younger.
So given that this at root is a really technological process, and like all technologies, there's obviously variation in skill or in equipment. If somebody is looking for a fertility clinic, how do they know what's a good lab or what's a good clinic? What would you suggest?
So, I mean, you want a lab that has success with it. I mean, some labs are freezing eggs and have never had a baby from it. That's not the way we did it. As you know, we spent 4 years in the mouse lab making sure we could do it before we touched the human egg. And then we did a free clinical trial. And there aren't many clinics in the world that I know that did that. We're actually one of the few. In fact, I think we're one of two where a free clinical trial was done, or a variation of it, to prove that we could make babies from frozen eggs. Many have just, you know, frozen eggs and made babies from it on the patients that they've treated. But you want a clinic that has success. You want a clinic that has volume. You want a clinic that's been using the technique of vitrification for many years and knows how to do it. And, you know, you need a team. It's not a doctor. It's a team of specialists. You have nurses that are important. You have laboratory component that's important. The embryology lab is critical. The equipment is critical. The infrastructure is critical. The team that is involved in managing your care, those things all matter. And you can find that out by asking questions.